There you go. There you are. Good.
Oh yeah, that feels good.
So basically, before I jump into this, where do you feel the lower back at the most right now?
Just that, it's basically the lower
Just
part,
that lower
yeah.
spot, right? Yeah, so right into that lower part.
Yeah.
And I know you said this has been going on 3. What happened? Do you remember, like, you just woke up or you...
Well, it was during the Labor Day weekend, remember? I don't know if I mentioned it to you.
Uh-huh.
So the night before, I mean, that day we were, we put some tables up because I had my brother and my sister come over. And so, we were putting the crock pots out there and, stuff like that. So
Yeah.
there was some lifting.
Uh-huh.
So I'm thinking maybe that
As you're
type of
doing
movement.
that.
Yeah.
Mm-hmm. But you didn't feel it right away.
No,
It was
no,
kind of like
it was-
a moment later.
Right.
Okay,
Right.
gotcha. So this is your L5 right there. Soar it all.
Yes.
Okay. And move up to L4. Not too bad.
Not too bad. I can take it.
And then
Yeah,
5.
right there,
Move
yeah.
down just a little bit. That's 1. It's pretty sore there too, right?
Mhm.
Okay. Okay. So yeah, so if you can remember that L5 where it's kind of slipped back a
Right.
little bit, just like I said, that's the one that we're going to need to move here. So that's
Okay.
the one that's making you flinch a little
Right.
bit. So today, just because of how severe the spine is, I'm just going to work on that L5.
Okay.
And we're going to see if we can get pressure off of there and see if we can get that joint to stabilize. But at the same time, I'm going to work on that, and that should help to get you some relief.
Okay.
But later on throughout the care, we will need to stabilize that foundation,
Yes.
which is your pelvis. But to get you some pain relief, we're going to work on that
First,
L5 here,
okay.
okay? All right, so just going to tilt you back to this back here. Yeah. So that should glide forward, but when I tilt you back, that doesn't glide at all.
Okay.
I'm going to tilt you back here. Okay, yeah, so let's get you started. We're going to do that L5.
Okay.
See if we can get some pressure off of there. And we'll see how we do from there, okay?
Okay.
So can you remind me, so in terms of the pain, is it more painful to stand or painful to sit?
Well, I can sit,
Mm-hmm.
but to try to get up, it's like it's such a pressure. It hurts
Okay.
to straighten up.
Yeah, I want to see in terms of your ability to stand. If you can go and stand for me. Where does it grab the most?
Right in there.
Right down in
Mhm.
there. Is it when you're arching back to stand further
Mhm.
up? Okay.
Mhm.
So we're going to work on this one here. If we can get a really good set, we're going to do that here. If we can't, I want to get you on the table behind me, but I think I can do it on this side here.
Okay.
So relax the leg here. There you go, just like that. The arm's going to come down just a little bit. Perfect. All right, so now your part, a lot of people when I do the adjustment and they get results and like, oh, I say good job. People are like, well, I didn't do anything. Your job really is a lot of work, and that's to relax.
Yeah.
Okay, so as much as you can, I just want you to just get your mind somewhere else besides here,
Mhm.
whether it be in the woods,
Yeah.
whether it be at the beach, wherever your happy place is. I want you to try to get to that place. Maybe just being home,
Yeah.
Just imagine you're at home. All right, hold it right there. Good. Now I'm going to roll you just a little bit. I won't drop you.
Okay.
I've never dropped anyone before. I won't
Mhm.
let you be the first. There you go. Good. Now, all I want to do is stabilize that shoulder, and I'm going to give a bit of a push right there, okay? Letting that go. There you go. There you are. We got some movement on there.
Yeah, I just heard a little bit.
That was such a baby movement.
Yeah.
But let's see how that does. So come on up, have a seat.
Okay.
Okay, so give it a second.
Mhm.
Whenever you're ready, I want you to go ahead and stand and I want to see how that does, okay?
Oh, that was easier to get up.
Okay, good. Now I want you to walk in place with your knees kind of bending up. There you go, just like that. Good.
Yeah, it feels good.
Okay.
And it's, I mean, I can do this. It's more the
the bending
the
down.
bending down, like put my socks on and stuff,
Mhm.
but
And I still want you to be cautious of that right now,
Yeah.
because when we get that joint to position, when you bend forward like that and it's still trying to stabilize, it will shift back out, okay? So I don't want you to be afraid of doing stuff,
Yeah.
but just be conscious for like the next, few hours. Try not to bend forward here. So let's have
Okay.
you sit back down.
okay.
And I want you to do one more. I want you to stand right back up again. Good.
Oh yeah, that feels good.
Let's have you sit back down.
Doesn't hurt as much to.
Yeah.
Yeah.
I was really hoping for a bigger set on that, but it just gave us a little click, and that might be all we're gonna
We
do
need
here.
for right now, yeah.
Yeah. Because the key is, sometimes even as a doctor, I get greedy and I want to get more.
Right, right.
But you have to remember just to be patient and just take what the body's willing to give us.
Right.
And so you can already see some results from just that little adjustment there.
Okay. So then the louder
Yeah.
the crack, the better?
Not really, and that's the hard part.
Okay.
is although I look for that crack,
Uh-huh.
and I will tell you, typically in our adjustments, we do get pretty solid, I guess if you want to call it cracks, but the sound is usually a deeper sound because we target the disc. We don't care about the cracks at the back of the joints. We want the front of the joint, which is the disc. And and you can even notice, like, last time I scanned your back, you flinched.
Yeah, and I'm good.
It's not flinching there.
Mhm.
And that's looking better as well. So that's doing pretty good.
Okay.
I think that's going to be where we're going to leave it at. So here's the thing, right? Because you have the disc here,
Mhm.
and then you have the joints in the back. The joints in the back, a lot of times this is where when you crack your back, you hear the clicking noise in the back. That's not what we're targeting here. We're targeting the joints in the front, and because it's a bigger joint, usually our adjustments sound a little deeper, so that you hear a little more of a clunk instead of a click.
Gotcha. Okay.
And so this is typically what I'm looking for. Now that joint space isn't very big at all, just because it's already worn out quite a bit. So we may not get a huge clunk on there, but especially in the beginning when there's a lot of inflammation in that joint, sometimes that little click is just enough so that next time when we get the adjustment, it might be a little deeper set. So we're going to leave it at that, and this is where, like I said, even as a chiropractor, sometimes we want like those big old solid adjustments. Sometimes we'll just take what we can get, and then that's enough to start the process. So what I want you to do, I want you to ice today, okay? And throughout the weekend, I want you to try to get some walking in, as much as you're able to tolerate. Just because now that we get just that little bit of movement in there, one, the ice will help to reduce the inflammation in there, but then two, the walking will help to pump out some of that swelling, okay? When you're sitting here, again, you can kind of move back and forward. And then also the best one that you can do is just letting your belly rock forward and then go back to neutral. Try not to go into that slouching position. So just try to let your body drop into that belly and then come back to neutral, because what we're doing, just kind of like with the adjustment, we're letting the spine open up to the front and then going back to neutral. We don't want to bend into that slouching position, because that's going to push the spine back. So just allowing it go in there. You can go side to side if you want, but mostly I want you to go back and then back to neutral here, okay? And so that's going to be it for today. At that point, when you come back in for your next appointment, we'll see if we're going to keep working on that or if we're going to move to something different. But I'm pretty confident we're going to keep working on that on the L5, okay?
Okay.
So,
And so pretty much we're working from down here up, because you know how that.
we will work on the upper
neck.
neck.
Okay.
Right now, less is more. So I'm just going to focus on that lower back. Next visit, I might work on the neck, but because of the position that I have to get you in for the neck, I'm just going to leave you with just the lower back today.
Okay.
All right. All right. So you're all set.
All
Let's
right,
get
awesome.
you going, and then ice for me.
Okay.
15 to 20 minutes. Get that ice pack with a paper towel around it, just so it doesn't freeze or burn your skin.
Right.
And then we'll see how things do from there. Okay.
Okay.
All right.
Awesome.
Any
All right.
questions for me?
No.
All right.
You
Well,
covered everything. Thank you so
I'm
much.
glad that you're here.